Subscribe to our channel now and press the bell icon to never miss an update from KIMS Global.
Hi, I am Dr.Shabeerali TU, consultant in hepatobiliary surgery, surgical gastroenterology and liver transplantation at Kerala Institute of Medical Sciences, Trivandrum. So as I have mentioned, this colon cancer can come to any person at any age, but usually after the age of 20. So once a colon cancer is or a rectal cancer is diagnosed, treatment is basically depend on at what stage it is diagnosed. So for the understanding of a common man, we can classify it into two types. One is a colon cancer or rectal cancer which is confined to the large intestine alone, which hasn't spread into any organ other than large intestine or its adjacent lymph nodes. So that we can call a local disease or a locoregional disease. And second group of patients are the patients whom the cancer at the time of diagnosis itself has progressed to other organs like liver, lungs or any other organ like bone or other organs. So based on these two categories we can decide treatment. Again, for the treatment, explaining the treatment, we can classify this colorectal cancer into either it is affecting the large intestine alone or the last part, the storage part of the colon, that is the area I explained as the rectum. So a cancer involving the colon or a cancer involving the rectum, because treatment options vary among these two tumors. So we'll take the first situation where you have got a cancer involving the large intestine other than the rectum and which is confined to the large intestine and to the lymph nodes. On the CT scan and other tests, it hasn't spread to anywhere else. This patient, the first treatment should be a surgery to remove the tumor along with the adjoining draining lymph nodes. That is called a colectomy surgery. If it is on the right side, we will call it a right hemicolectomy. If it is on the central part, we call it a transverse colectomy. Or if it is on the left side, we call it a left hemicolectomy. Or at that final part, sigmoid colon, that is another part of large intestine, we call it a sigmoid colectomy. And in some people, as I have previously mentioned, this hereditary tumors, like a person with a high other family members also having colon cancer, they are at high risk of having the condition called hereditary non-polyposis colon cancer. Such people needs a subtotal colectomy where you have to remove most of the colon except rectum. And in people whom I have mentioned previously, like an ulcerative colitis or a polyposis coli on which they are getting a colon cancer, they should undergo complete removal of the large intestine and the rectum. So in the colon cancer, which is confined to the colon and into the lymph nodes without any spread elsewhere, the primary treatment is surgery. And based on the stage of the disease, after surgery, we can properly stage the disease pathologically. The final biopsy report will come. It will tell us whether it is confined to the colon alone or whether it has spread into the lymph nodes, nearby lymph nodes. If there is a lymph node spread or if it has grown beyond the wall of the large intestine, those people will need adjuvant chemotherapy. Adjuvant chemotherapy is a chemotherapy which is given after the surgery to control any cells which are spread into the blood which we are not detecting at the time of surgery. So this is called adjuvant chemotherapy. You may need 6 cycles or 8 cycles of chemotherapy depending on the tumor stage. So for the colon cancer which is confined to the colon and lymph nodes, it's basically primary treatment is surgery and chemotherapy based on the pathological stage.